Doctors of Reddit, what patient made you go how the frick are you even alive? I had liver failure. When I was 8 months pregnant, my baby had stopped moving for several hours, so they did a C-section. They found out during blood work that my liver had failed. I almost needed a transplant. I bled so much that my body used up all its clotting stuff. I was in ICU for 3 days, in hospital for 2 weeks. My liver recovered. I went home with my son. We could both have died. The hepatology department and maternity department were working together, which is not a usual thing for them. So happy you're both here today. Patient here. When I was 7 I had horrible asthma. My mom often lied in my bed with me and listened to my breathing. One night she fell asleep and jerked awake in the wee hours of the night and found I was not breathing. Goes to the ER immediately because it was only like 10 minutes away. Not sure what happened while there, what tests they did, but I was declared dead. In the morning I woke up, asked who I believe was a nurse where I was, and she started crying and called in my mother, who hadn't slept all night. The doctors said they didn't know how the frick I was still alive. Now 16 and haven't had any hospital worthy complications since. And god dang it, my mom is the most amazing and loving person on this green earth. Your mom probably never slept again, holy crap. I'm a hospital medic and my first serious trauma was a guy that got shot in the neck. Somehow it missed everything important and went right through. Minimal bleeding, no C-spine damage. Just a hole through his neck that didn't pierce his esophagus, trachea, or any major vein or artery. Dude was just chilling in the room. And then 2 weeks ago we had a gunshot that would not have made it to the local trauma center. Hit his femoral vein but was still gushing blood. One nurse stuck her finger in the hole and it stopped the bleeding, and I found a second wound in his chest. No bleeding at all, it just looked like a weird indentation. We couldn't even tell it was a gunshot at first, and I stuck an IV adhesive sticker over it to vent it and prevent a collapsed lung. The guy's blood pressure was in the toilet and wasn't even able to read on the machine. We needed a manual check. By the time we got him sort of stable and with decent vitals, and got a surgery team in early, we were drenched in this guy's blood. Pretty sure most of what was flowing through him was saline and other people's blood. He survived though. We also had one woman whose entire abdomen was fully open under her belly, and everything in her was horribly infected. We basically told her we can't stop that much infection and she opted for hospice care. She was in so much pain I don't know how her family even got her to the ER. I lifted up her gut to look underneath since I was the first in the room to assess, and I was hit one of the most rancid smells I've ever experienced. Literally everything from the waist up was infected. There were some unnatural fluids draining right out of the completely open bottom of her stomach. I mean it when I say you could just lift it up and look right inside. I had lost a lot of blood to anemia and went into the doctor for something else. She starts looking into my eyes, my gums, pinching my cheeks and telling me that I'm several anemic and then said, "Are you always this white and pale?" And then I'm like, "Yeah, I guess." And then she made me take a test. Turns out my blood level hemoglobin was at 6.5 and dropping because of my heavy menstrual cycle and stomach issues not absorbing iron. I had gone into the doctor because I had really bad heartburn. And turns out that I was really low on blood. It explained all the dizziness, coldness, eating ice by the pound. Auditory hallucinations were happening and I started to just not care about anything. Had numbness in my whole body as well, and trouble breathing. I'd been in such a dire state that I started to accept all of these things as normal. When I checked myself into the ER, I told them that my doctor told me to come in, but I think she was overreacting, and I can probably just go home. They quickly tested me. My blood level had dropped a little in a couple of days and I still had heavy menstruation. They quickly admitted me to start my blood transfusion. They said that had I waited I would have likely gone into cardiac arrest or would have just died in my sleep. After the blood transfusion I felt amazing. I could breathe and my skin color was back. I had a patient in the emergency room who had been involved in an awful car accident where firefighters and paramedics spent an hour trying to get him out of his car. Reportedly, he attempted to walk to the ambulance and when he arrived he was awake and talking. Confused speech, but still. Then paramedics signaled the back of his head to me. His skull was popped open on the back so much that I could see inside. We paged the brain surgeon immediately and the patient was taken directly to the operation theater. Months later I heard from my colleague that he was still alive and had no damages other than some occasional balance problems. So not the doctor but the patient. I had a super bad allergic reaction that was a specific type of allergic reaction that was deadly on its own. It would have been deadly if I had only taken a small bit of the medicine I was allergic to, but the doctor that prescribed it accidentally prescribed about 10x more than what the maximum dose for that medication is supposed to be. So not only was I super allergic, I was also overdosed on what I was allergic to. So that led in 2 weeks of me being in the ICU and doctors thinking I had about a 3% chance of surviving at best. Every time I was conscious and had family visiting, a doctor would tell me to make the most of it because I probably wasn't going to make it for their next visit. Eventually I somehow recovered, but for about 2 years after I was still regularly going to several doctors to make sure different things were okay that were affected by it. Every single doctor I went to would hug me and would have other doctors and nurses come in and say something like, "Hey, you don't remember this because you were unconscious at the time, but I helped restart your heart," or "I was the person that vacuumed the blood and pus out of your throat that was blocking your air path," and they were just all amazed that I made it. It's been about 8 years since it all went down and I've run into several of the doctors and nurses around the city and they still recognize me and still hug me. It amazes me how in such a large city with such a huge hospital that gets the most extreme medical cases from around the world that they still remember me being there. Not a doctor, but a patient. I was in the hospital after a pretty gnarly 4-wheeler wreck. I was destroyed, fractured my skull, broke 3 ribs, my right shin, it was sticking out of my leg, broke my collarbone, my right arm, had some pretty bad cuts, bruising, fractured 3 vertebrae in my lower spine, and internal bleeding. I've had a pretty high threshold for pain basically my entire life because I've always been clumsy stupid, but that was god awful, even after I was given pain meds. At some point, IDK exactly when it was, I was in and out quite a bit. I heard 2 doctors conversing outside my curtain. One of them said, "I don't know how she keeps regaining consciousness. There's no way she should be awake right now." The other doctor replied, "Honestly, I don't know how she's even alive. I think they thought I was asleep." IDK. But that scared the heck out of me. Not a doctor, but was the patient. When I was in boot camp, I developed an upper respiratory infection during second phase. I didn't want to get dropped back a platoon, so I gutted through, got back and went to sick call where they treated me for a host of things. When they x-rayed my chest, the doctors came out with my films and literally asked, "How the heck are you still alive? Your lungs are so full of mucus you should be dead." Turned into walking pneumonia at some point. I also had athlete's foot that turned into cellulitis and my last wisdom tooth yanked. So the combination of meds they had me on was enough that I don't even remember that week at all. I'm not a doctor, but I did meet a patient who fell from a 5-story building, landed on his upper back, woke up in the hospital the next morning and got up walking around like nothing ever happened. Barely a scratch on him. Think about it, every time I'm in a building with at least 5 stories, just looking down like, how in the world did this guy walk away from that like he fell off his bike and took a nap? Actually, I've seen worse injuries from someone falling off a bike, lol. I'm a midwife and we have patients who have massive obstetric hemorrhage, which is classed as any blood loss over 2 liters. This can happen for a variety of reasons. We had a patient who unexpectedly started hemorrhaging following an uncomplicated normal vaginal delivery and we just couldn't stop it. As soon as we pumped blood in, it hosed out. The doctors had to perform an emergency hysterectomy and the bleeding stopped. I think it's fair to say we were all shocked, not just at the incident itself, but at the fact that this woman lost 8 liters of blood. Also, that she spent just 1 night in intensive care before she was back on the ward, caring for her newborn, and she was home within a week. Women are bloody awesome, excuse the pun. For reference, women usually have between 4.5-5.2 liters of blood circulating in their body, hence 8 liters is very scary. This was many years ago, so I can't recall the exact details, but basically, we had a lady on ventilation with sepsis and multi-organ failure, renal failure, respiratory failure, metabolic acidosis, deranged liver enzymes, the whole works. We counseled the family and they agreed to withdraw life support, so DNR was issued and we took her off her ventilator. A few days later she's still around, unconscious, still in full-blown sepsis with multi-organ failure, but brainstem functions were there. I remember looking at her charts with my registrar, I think resident in the US, and my registrar going, but how? Then one day, maybe about a week on, during visiting hours, the patient's son approached us before he left to thank us for looking after his mother. His parting words were, and I kid you not, I don't know if it's relevant, but my mother practiced black magic. My registrar made the ward sister contact the hospital chaplaincy team to inquire if they do exorcism. They don't. First day of my emergency medicine clerkship, saw them wheel in a motorcycle accident guy who had dozens of broken bones, arms, legs, skull, etc., amongst significant soft tissue injuries. GCS was in the single digits. Had a decent pulse when they brought him in, but it was fading fast. Fast scan showed he was pretty much bleeding into every space in his abdomen and pelvis. The guy looked dead. His co-rider had already been pronounced dead in the field. Hands and feet were the same color as the white sheets on the gurney. Pulse was barely palpable. Lips were blue, etc. Anyway, the trauma surgeon apparently sees something or has a flash of inspiration. I stepped away for like 5 minutes while they were putting in chest tubes to go check on one of my other patients in a different room. Because as I head back over to the trauma bay, they are whisking this guy off to the OR. I hear from a nurse the next day that they cracked his chest, called in vascular and CT surgery in conjunction with the trauma surgeon to stop all the bleeding, and then closed him up once he was hemodynamically stable, but obviously in grave critical condition. There was no telling in the short term what kind of neurologic deficits he'd have from the fact that at one point, 80% of his blood was chilling in his abdomen rather than his vessels. Heck, I didn't even know if the guy's spine was intact or if he'd be paralyzed just from the physical trauma. Anyway, lo and behold, exactly 30 days later on my last day of emergency medicine, I bump into the guy and his family members leaving the hospital through the main lobby, holding fresh discharge paperwork in hand. He's being pushed in a wheelchair because you can't really use any arm strength without splitting your sternum open after the kind of surgery he had. But dude looks good. He's laughing and joking with his wife and trying to tell her that he can walk out of here if they'd left him. Pretty crazy considering when I saw him he was pretty much a broken corpse. My blood sugar was more than 1000 when I was diagnosed with type 1 diabetes. I was less than a year old. My mom had taken me to the doctor's office 4 times in 3 days, but the nurse called her a nervous mother and sent her home. Also diagnosed with Addison's disease a couple years ago. I'd probably had it for months and had been living on my own in a town where I knew nobody. The day I got home I basically had a conscious blackout. Happened a few more times over the next couple weeks and I lost the ability to sense low blood sugars. When I was finally hospitalized I was in Addisonian crisis. Took them 3 days to bring in an endocrinologist, and he knew what was wrong within minutes. They told me my heart would have stopped within a week due to low sodium high potassium. Not a doctor but a registered nurse. Last summer between the months of June to September we had a young male, 19 years old, who crashed his motorcycle and was sent flying through a van's windshield. By the time he came onto my unit he had gone through so many operations and I heard he needed to have over 100 blood transfusions within the first month to keep him alive. He also ended up losing all movement and sensation from the belly button down as well as losing his left arm. His right arm was intact but barely functioning. Neurologically he was with it. Knew his name and that he was at the hospital, but I honestly don't think he knew what happened to him. His family members were very nice and I could only imagine how they were feeling. I honestly have no idea how he was still alive. He couldn't sit up straight anymore because he would be in terrible pain 24/7, but if we laid him flat he couldn't really clear his secretions. I'm surprised he didn't get pneumonia or aspirated or something else. We discharged him to a long-term acute care facility and that's the last I heard of him, but it's just such a sad story considering he is only 19. What a tragic story. Not me, but it's this thing my dad used to tell my sister and I. My dad served during the Gulf War and said he had to work on a guy whose head got ran over by a tank. What happened was a Marine fell asleep against the treads and the tank drove over him. Guess the fact they were in a sand and wearing a helmet saved him, but only barely. My dad said the guy was still incredibly messed up. He never went into specifics. My old roommate's wife came to our apartment one night after working in the air. She is an NP now in a practice, but she worked in a hospital for a while. A patient had jumped off his third-story balcony and landed in a bush and was totally fine. So naturally, he tried again. The second attempt, a branch got lodged up his butt. When they removed said bush from his butt, he lost the elasticity of his sphincter muscles. The man will never be able to not crap for the rest of his life. I'm fairly certain they can give you an artificial sphincter now. I'm late here, and not a doctor, but late last year, my dad went to the hospital early in the morning with terrible stomach pains, thinking he had a bad ulcer. My mom called me at 7 AM to tell me he had had a heart attack. A couple hours later, after an angiogram, the doctor tells us that he has multiple artery blockages, including the LAD, commonly called the Widowmaker. He has probably been having heart attacks for years, and he has just shaken them off like it's nothing. He had a quintuple bypass at 8 AM the next day, and he is almost totally recovered. We are looking forward to going to a theme park this summer and riding roller coasters with doctor's approval. My grandfather is a medical anomaly. His doctors hate him so much. He cut out a cancer lump with a pocket knife. I was like 9 and held paper towels. Cut his thumb in half. Stumpy. Then the pointer on the adjacent hand, the long way, looks like a claw. Cut a hole in his middle. I was young and helped clean and bandage. Survived a stroke. Has a brain aneurysm, a hernia, and like 4 teeth. He's a frickin' mess, but still kicking. My grandma was similar. Had aggressive skin cancer and bought carbolic acid from the vet and would burn it off the man. Then we cut and debride until we got to healthy bloody tissue. Like more than 20-30 times I helped her as a small kid until I got to be a teen and refused because I was scared I'd kill her. Just thought of a case I had while working in stroke rehab. Not a doctor, but I saw her scans. Like 60-70% of her brain is gone. The woman had a headache years ago when she's in her 30s. Went to the ER and doctors told her it's a flu, gave her painkillers and sent her home. Needless to say, it got worse. She went to the hospital again after at least 24 hours. Think she waited 4 hours in a bed before getting an MRI, and by then, according to her family, she's already not that conscious. The doctors said it's a small hemorrhage that bleeds slowly and the tear got bigger. She got emergency decompression and clot evacuation, but it's still 36-48 hours too late. She lived because the op saved her brainstem, and her family is well off enough to afford care staff and continuous rehab. But her mentality is like a baby and she could not even sit up. Sometimes I wonder if saving her life is the right thing to do. I was very early in. This kid hit up a convenience store near the hospital where I was working. Killed 2 people, one a kid. He had been beat to crap, shot, and wrecked his car. Thanks to the magic of CCTV and video monitors, it was all recorded. That was his last free day. My job was to get him in and out. We go him up and running. And the real hard part was seeing a 19-year-old realizing life as he knew it was over. He made his choice. Dang though. Holy shit, this was last October. I am a medical student. I had a patient who was 103 years old hospitalized for sudden loss of consciousness. She woke up next morning, discharged 4 days later. She just had a hypoglycemic attack. She is a retired nurse who worked during World War II. Not a doctor. Former EMT. One time got called to a guy who had been stabbed in front of a bar. 30 odd wounds. Face sliced halfway off. Bowels out. Sucking chest wound. Impossibly severe bleeding. It was an absolute mess. Dude apparently survived. 3 days-ish later, different guy walks out of a different bar and trips on a curb and hits his head on a patio table. Talking to us on the way to the hospital. Dies 2 hours later from a brain bleed. Sometimes you just don't know. I am in a dock. I had a sweet little girl accidentally get caught on some rope that wrapped around her neck while going down a slide, causing her to fall off the side and hang herself. Her dad does CPR on her until paramedics arrived. She came in with a pulse but not breathing. We put her on the ventilator but couldn't get her oxygen up because the lungs fill with fluid after a hanging. She got put on an ECMO machine. Oxygenates blood and bypasses the lungs so they can heal, which was a Hail Mary at this point. In the ICU she develops abdominal compartment syndrome and has to have her belly open up at the bedside. She then proceeds to lose her heartbeat 8 times, including 3 times from developing a spontaneous pneumothorax and once from a nurse tripping over the ECMO power cord lol. And the doctors and nurses in the ICU get her back all 8 times. She survived it all and was discharged from the hospital 100% neurologically intact. Kids are amazing. I visited her before she got discharged and cried with the family seeing how great she looked. Best case of my career. Nurse here took care of a man who had a platelet of 4. Yes, 4. Minimum is 150,000. I was literally surprised he didn't bleed to death from just turning in bed. Had to send him from nursing home to the hospital at that point. Then he came back and still had platelet of 4 when labs was done a few days later. Out he went again and came back. Did labs and platelet were 3. Sent him out again. He finally came back and was admitted to hospice. He had this rare form of thrombocytopenia, and while platelet transfusions were given, they didn't help much. I was amazed that those 3-4 platelets keep him from bleeding out that long. Him and his family were very nice though. I'm not a doctor, but I do know a story that surprised most doctors. I am currently 19 years old. My childhood was quite normal at first, but everything became quite dark when my grandfather got cancer in his testicles. When he started chemotherapies, everything was very hard for him and for the whole family. My cousins and I used to visit him after lessons. A couple of years passed and our grandfather recovered from cancer. But the smile was erased when they told us that he had metastasis, so the cancer spread to the part of the rectum. He had to start chemotherapies again. Luckily the cancer was not as serious as the previous one. Although it sounds strange, my grandfather survived and cured of the second cancer after a year. There were no longer any forecasts of any other terminal illness. At 17, my grandmother passed away, which made our grandfather move with my family. But being quite impatient, he would go out from time to sunbathe and feed the birds. He went to the park by bus. One had done at night and my grandfather had not come home. He took the bus, but the driver was drunk. The bus crashed. 4 people died and 7 survived, of which my grandfather was. We did not realize that he had disappeared that night. The next morning we found him in the hospital sitting as if nothing had happened. We all burst into tears as he complained about the decanter while laughing. My mother joked that God had forgotten to take our grandfather to heaven. This year my grandfather got the flu and we went to the doctor. After writing the medical history, the doctor almost dropped his eyes when he saw that he was still alive. I had an adult patient who was missing the right half of the brain. I know a dude with only half a brain. He's totally normal. Cardiac surgeon here. Had this happen twice. It's called an infarct aneurysm. After a severe heart attack, the dead heart muscle balloons outwards with every beat. Not completely compatible with life with progression of time. What was shocking was, the aneurysm ruptured in these 2 patients and was resealed by the pericardium spontaneously. It was literally a hole in the heart wall on the outer side being patched by a thin membrane. Ticking time bomb. One of the patients got operated, is now fine. The other one refused surgery. He walked home. Not a doctor, but a witness of a doctor saying this to my grandpa. The guy was not even 40 when he was diagnosed with esophagus cancer, which had spread to his lymph nodes in his neck. He was operated but was told he would probably never be able to eat solid food again and have difficulty speaking, as the main tumor was located on his larynx. Chemo and radiation was used to treat the spread in his neck, but there was a high chance he wouldn't survive it as the smaller tumors were inoperable. But he survived. He learned how to swallow again and regained his speech. All was good. Then he got a stroke. Within the year, doctors thought it could be his artery in the neck, damaged from radiation treatment that created a cloth. So as he had just recovered, he was now unilaterally paralyzed by the stroke, and again unable to speak or swallow. Years later, he is now able to speak and swallow again, and part of his paralysis is recovered, or he has a way to work around it. Due to him being 50, cancer strikes again. He now has tumors in his prostate, which is spread to his testis. They remove most of it and radiation and chemo do the rest. Now the poor man has no testosterone production anymore, so he is put in artificial testosterone. He is now almost 80, and a few years ago they found multiple dormant tumors, some in his bones, and one in his prostate. They have been treated with chemo and are now under control. He is weak as a stick sometimes, but always recovers. His doctor said to him, the last time he was in the hospital, that he has never seen a person going through so much illnesses and cancers for 40 years, which each one a slim chance of survival, but always recovering. My grandpa, a slightly religious man, said, when the angels are calling, and I think I might finally lose the fight, I turn off my hearing aid so I keep fighting. Patient here. I had a giant tumor pressing on my spinal cord. It's a kind of tumor that is super rare to be located in the cervical spine and exceedingly more rare to have so young. When the doctors found it, they said I could have been paralyzed from the neck down in a month or so. I was in surgery in less than a week. The tumor was also pressing against the important artery that is right next to that area of the spine. There was a chance I would bleed out during surgery if it was accidentally nicked. Also, the surgeon said that if the tumor had damaged the nerve ending it had started to grow on, then I would lose usage of my right arm. I'm only 21 and I am right-handed. 6. 2 hours of surgery later, I wake up with an 8-inch incision down the back of my neck, and no in-surgery complications. My arm works just fine and I have all the feeling back in my body that I had lost. I'm finally able to tie my shoes again after losing fine motor movement in my hands. I have an appointment on Thursday to see if the tumor is growing back at all. Wish me luck. Not a doctor, but the patient my neurologist was totally confounded by. At the age of 21, I began having episodes of semi-consciousness, which lasted 2 months. My doctor could not figure out what was causing the problem, even with repeated blood tests. Then one Monday night, I prepared for bed. The next thing I knew, it was Friday afternoon. I was intubated, hands and feet bound to the hospital bed. Come to find out, my seizure medication had stopped flushing out of my system and was shutting down my body. My sister had found me in the floor beside my bed on Tuesday morning, seizing in my own vomit, which I had aspirated. I apparently spent the majority of my time seizing over the next 3 days, as my doctor kept changing medications to stop the seizures. He had told my family to start funeral proceedings sometime Thursday. On Friday afternoon, I awoke, scared to death by my situation. Not only did I survive, but so did the child I was pregnant with, unknown to anyone. 30+ years later, I'm still plugging along and that child has children of his own. Until retirement, my doctor continued to refer to me as the one patient he would always be amazed by. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.